Pregnancy is a window of opportunity to stop smoking. Many women do stop, but if they don't stop when they're pregnant, they may continue to smoke, and they may continue to smoke for many years. And as we know, 1 in 2 regular smokers who continue to smoke will die prematurely of a smoking-related disease, so those women are at risk as well. If you put together the risk to the child and the risk to the mother, there are of course substantial costs associated with that for the NHS and for society.
In the UK annually, smoking in pregnancy is estimated to cause 5,000 miscarriages, 2,200 premature births, and around 19,000 low birth weight babies being born. There's strong dose-response relationships between ectopic pregnancy and smoking. And in an ectopic pregnancy, basically the baby develops in the wrong part of the body and has to be removed surgically, so it results in fetal death.
Around anywhere between 1 in 3 and 1 in 4 women are smoking in the year leading up to or during their pregnancy. But then we have another source of data which looks at whether women continue to smoke throughout their pregnancy, and in England that's measured at the time of delivery. And the figures there are much lower. They show that somewhere between 12 and 13% of women continue to smoke throughout pregnancy, but that's still a substantial number of women.
Lots of women find when they're pregnant that they're very motivated to stop, and in all areas of the UK there's stop smoking services that are tasked with offering support and help to pregnant women who smoke. The intervention for which there's the most proof of that it works is simple behavioural support.
NHS stop smoking services across the UK are there to support them, and women can be seen in most regions in most parts of the country by a specialist smoking cessation advisor who just works with pregnant women. And she will see a lady regularly, probably weekly initially, and after that tapering off throughout her pregnancy, and provide her with what we call behavioural support, which is regular counselling around ways to stop, how to deal with cravings and withdrawal symptoms, and also offer her a nicotine replacement therapy if that's appropriate.
There's quite a controversial method of helping women to stop smoking in pregnancy at the moment, and that is giving them financial incentives to motivate them to stop. And that's attracted quite a lot of criticism.
So in 2010 we started a trial in Glasgow, which is now coming to an end, where women were randomised into 2 groups. The first group of women received normal NHS stop smoking support to help them quit smoking. The other group received that, and they also received financial incentives. And the incentives, if they continued in the scheme up to the end of pregnancy, were worth about £400. And the early results are really promising. At the moment, these are not the final results. We see a difference of about an 8% quit rate at the end of pregnancy in the control group, compared to 20%, 1 in 5 of the women in the intervention group. We would say that £400, that amount of money, compared to the costs of paying for a premature baby and its care, or the longer term costs of smoking to the woman's health to the NHS, is highly cost effective.
Pregnancy is a really motivating time for women to stop smoking. And if they can manage to stop smoking permanently when they're pregnant, that means their babies are much less likely to be exposed to tobacco smoke. And actually, it means that their children might be less likely to become smokers themselves.